mothers, they give birth to child in the bush. It's a hard process. Sometimes mother die or the kid die.
Last time cholem, last month, nerevla kandre dumia, carry pinini, but go them no come out. Stop for 3 days. Namibla ring chobalo tabubilo no kam kisimento.
No woman should have to risk her life to bring a child into the world. Yet for women in rural Papua New Guinea, that risk is a constant and unavoidable reality. In some of the most remote places on Earth, childbirth isn't just dangerous because of complications. It's dangerous because skilled care is far away. Mothers often deliver in the jungle due to distance, cost, and lack of facilities.
For the remote areas, nothing, no logistic, nothing.
Reaching a hospital can take days, multiple trips by boat, along rough roads, and on foot, all while heavily pregnant. Even when a mother has the strength for such a journey, the cost often makes it impossible. 80% of the Papua New Guinean population live outside the formal economy, where people work for survival and cash is extremely hard to come by. The Collective Empowerment Foundation's Safe Birth program is a solution designed by, with, and for the communities to allow mothers to give birth with safety, dignity, and support. Importantly, CEF operates as a non-profit social enterprise, meaning we are a service provider, delivering an essential healthcare solution free to families who need it most. These families receive care at no cost. While the service is free for mothers, the work behind it is not. Infrastructure, transport, food, and staffing all require sustained funding. Think of us as a construction company contracted to build a bridge, except instead of infrastructure for cars, we build access to safe healthcare for mothers. And instead of being funded by shareholders or past profits, the work is commissioned and funded by governments, philanthropic organizations, and private corporations, committed to strengthening health systems and community outcomes. The Safe Birth program was made possible through private funding from Shimi, who took a chance on us at the Collective Empowerment Foundation and supported the pilot phase of this program. In its first 6 months, 44 mothers safely delivered through the maternal waiting house. That proof of immense impact has enabled us to partner with local government and begin extending the program across the Western Province to help as many mothers as we possibly can.
This is the way forward.
That Delta baby is for the nation, for the district, for the family. And
it's like a part of community. We want it. We want this type of organization to be in Papua New Guinea. Yes, to help us.
Kanu pagavunta sene akuredi. Kanu paga sanamundi si kanu baven kuso. Traho kobrioko.
Suasa dinna. Aku sune suasa da sedaro suki aku sika. Mari ni ka fena kan ko hat kina. Kinsen ko hat kina. Brukusa kurindin whiteien gengin brukusa nisabut men ko full set biasuri. Thank you Yema. Kan ko kiafika kan ko suasa dika dasurika sanam mami ka ngrasi nga men but men homa pulika. Manja kan ko relax one. Peske ke kuringa desafika papa kota so free dika. Amiki fa.
Tu amos sea go hanwa gansi. Town dimap keno go hakina transport go. Akan transport ya problem akan. Mai go ikan pakai free dirade. Serestaso mangru thari.
Mo ko hak kina. Mai ko ma ko maisi kina. Te no kan feel da ko do ko gehmende fo ko din go free. Mura transport guy kan treiga so free. Mura bed fee go so free. Ano kan go wena keren ko interest re. Free service mo pa ko interest.
I'm making jusa truerin, sere truerin, suffering sa. So jusa ko bigi ka 1 month sa hapke mo. Makia ko tua mo kren go still enough do. Jusa ko still need it.
Your organization is the type of organization that is coming to our aid in terms of trying to lift up our health indicators. One of the programs is maternal health care that we always want to drive and see indicators growing, but we actually every time struggling to climb up there. And with this, I know that if resources are put together and supported in terms of financial resources and manpower and skilled manpower that we may talk about, I know we'll be able to roll out a lot of things. So from the district level, with your coming in here, CEF, coming in with this program to help the northern part of this place, I believe it will add value to the young women, especially our youth, to do a lot of things in terms of looking after themselves. From myself, as long as I am in charge of the district, you have my support.
20 mothers came, actually 41 mothers were here. They were here and then he saved them and then they went out. They went out, nice babies didn't die. They were all safe. Mothers and babies were safe. I was here, I'm living on that side. Actually, I was here and I went that side, so I heard that all mothers were all right, babies were all right. This organization is very nice. So I'm very proud of this organization.
And the village is no place to give birth?
No, village, we discourage people to give birth in the village. So hospital is the right place. It's important, very, very important that mothers are looked after well and deliver safely at supervised deliveries.
What is the biggest barrier for getting to Kiunga?
1 transport, 2 money.
I can transport there.
Transport na money.
The common thing that a mother gets delayed here is the transport.
On average, it costs 173 kina to get a mother to the maternal waiting house. This doesn't sound like much, but in rural communities, life is mostly shaped by subsistence farming, bartering, informal markets, and mutual support. Cash moves slowly here. For most families, 173 kina is simply insurmountable.
I'm Thomas Kasper, village committee in charge of this. My life with my community in Swetingen is very, very difficult to live. Transport and medical assistance, all those ones is very, very difficult to my life with my community.
From here to Kiunga, it takes some miles away. It takes, by motor, it takes us a day traveling. It takes a day traveling. By walking, maybe a week.
When the nearest facility is far and cash is scarce, how do you reach skilled care when labour begins? Mothers often arrive late, exhausted and clinically unstable. These patterns drive avoidable risk for both mother and newborn, and also places pressure on maternity wards by increasing emergency presentations and making care unpredictable.
The workload is too much for us, yes. If we can't manage most of the cases, we call our doctors, and at the moment our doctor is out for leave, and it's us only managing most of the cases here. And it's a stressful for us here, stressful work that we are doing in here.
And when a mother cannot reach a hospital but needs urgent help, there is only one option: helicopter evacuation.
For emergency, it costs more than 20,000 for a chopper flight. Plane, yes, if airstrips are there on emergencies, you have to pay about 10,000. So people can afford to do that. Yes, we have provincial government who put in quite some amount of money, but it can do for only maybe 5 people. maybe 50,000, which is not enough.
CEF is changing this model by shifting the system from reactive emergency response to planned proximity of skilled care. We enable mothers to arrive early, safely, and with dignity, connecting them to the existing clinical system before crisis begins.
So with this program, it's very good. It's really helped our unfortunate mothers. So like we talk about, safe deliveries. We can talk about safe deliveries, but how will they come in to have the safe delivery? With your program here, it's very good. It really helps the mothers from the remote places where they come, stay around, and they go in to have the safe delivery, which is very good.
This idea supports the mothers because we find hard to support them from the finance and food, and also to transport them back, it's hard. But this idea, I support this idea. For my suggestion, I want this organization to continue, and then it will support all the remote areas like this village.
This is the way to go, and I want to encourage you to continue to go beyond what you have now established. Think broader with the little that now you have done, maybe extend your programs to other areas as well.
What you're about to hear is a story that is far too common.
The furry mother that came here from one of the little place in Debepari, working 3 days. Yes. Plus the other day that she walked from her village to Debepari, make it 4 days. So,
all whilst heavily pregnant?
Yeah.
Damn.
Yeah.
That's a strong mother.
Yeah, strong mother.
In rural Papua New Guinea, a mother will walk more than 50 kilometers through dense bush while 8 months pregnant to afford herself a chance to give birth safely. This is the reality the Safe Birth program exists to change. So let me tell you exactly how it works. We support mothers from when they are 8 months pregnant until 2 weeks after their birth. The process of identifying women most at risk and referring them into the program is done through the existing healthcare system, which is comprised of aid posts and the local maternity and child health services, as well as word of mouth as the program spreads village by village. Each mother and one family member of her choosing is supported to travel to the maternal waiting house. Experience has shown us that family presence reduces anxiety, improves retention, and increases the likelihood that mothers remain close to skilled care until delivery.
My name is Gesson. I follow my wife to come and stay here.
When they arrive, mothers are accommodated at the maternal waiting house located on hospital grounds, a safe and free place to rest, eat, and prepare for birth while remaining close to clinical care. When labour begins, mothers deliver in the hospital maternity ward under skilled supervision. We also provide a care package to each mother that includes the basic necessities she will need for herself and her child. When the time is right, we support each mother through the safe repatriation back to their communities. This is Tandrew, our program director. He brings years of experience as a community health worker and a deep commitment to maternal health. He's also a father of 2 and understands both the clinical and human stakes of safe birth.
Since after graduate in 2014, I started work as a CHW, community health worker. And from my experience, I have saved one antenatal mother. She doesn't know that it was close to her, due delivery time. I assist her and she was, happy. The mother didn't have any money, no nothing, no everything, care package, no nothing. She just came in. At that time, I have only 1 tenkina. I saved her and said, this is for both of you, dinner. Just eat what you can eat and sleep. Tomorrow I'll see you right in the morning. So when I got back in the morning, I gave them 200 kina and said, just buy whatever you want, save yourself. This is for you from my heart. I'm giving it to save you both. So I did it. Which made me really challenging to help mothers here. So CEF, thank you for bringing this initiative. And the husband gave the name of his son, called after my name, Tendro. We're close to the CEF facility. Yes, the greenhouse is the mother's house.
How quickly was this place built?
Yeah, the building itself, it took 19 days exactly. It was proposed for 6 weeks, and then we got the competence to hire local hires, and they built it within 90 days. This is the washing place for mothers, and it's for public as well. Yes, they wash around here, wash clothes, everything in here. And then we have the toilet. It's a pit toilet. It was done by myself with 2 others. We did it in here, it's too swampy, and we cannot build dig some other pits, so only one we have. All right, thank you. Let's go on the other side. We have the veggie garden in front. We plant only greens, Ibica especially. In some months' time, we'll harvest it. The 3 solars, we use it for light. At night, we don't have electricity from the hospital. We have 250 liters water tank, which we use for drinking. And this year, how many mothers here will be saved by this tank? And we have a dish rack here for dishing, washing plate, cups, spoons, pots, everything in here. We use that water. We don't use that water for drinking. We don't use that water for washing, but this is different water set for dishing. Backyard garden here. Yes, we have Ivica, banana. We just planted when we came in. So when it's ready, maybe we'll feed the mothers with it. This is chefs for flu and cold. This is good. That's the sago farm. Yeah. So let's go in and we see the sago inside. This is our general waste bin or food stuff. We discard them at the backyard garden. And biohazard waste, the really high risk one goes to the pit, and low high risk, we separate them and is taken to the hospital. Here's the kitchen. Let's see what's inside in the CF kitchen. We have banana, we have cow. Oh, that's my plate of food. This is the sago that I was talking about. This is the sago. We feed mothers with this one to grow healthy babies. So we have two places of cooking. One is the fireplace, another one is the stove. This is water jerrycan that we refill always when the rain comes. We refill those.
Is it sometimes hard to get water?
Yes, it is. When this one runs out, we always run up to the hospital, doctor's house to get some more waters. Now into the office. All right, this is the table. We interview mothers in here, a whiteboard to keep update the mothers. Current mothers, yes, we have 6 on board, 1 on standby, and then daily updates, whatever we need to do during the day, we write them here, and then we follow the plan. On the other side of the house, this is the place where I stay, or myself and Tiao. We stay here, and we take care of mothers. All right, welcome Nelson. This is mother's room. In here, I have 10 sets of beds where I receive mothers, and then I always give them the bed, they stay. So currently, I have 6 mothers on board, and I have 1 mother on standby.
Evidence from comparable settings shows that hospitals with maternal waiting houses experience up to a 47% lower risk of perinatal mortality compared to those without.
I find that when we deliver to healthy babies and look after them, they will become intellectuals. That's what you'll find, that many young people will be more intellectual, more brighter. You are also educating Papua New Guineans through safe birth. And You know, they say you educated a woman, you educated a nation. For me, as an experienced district health manager, I like to see this program moving, extended further up into other parts of this province and in the country. And I think it will really help us.
My wife, the first pregnancy, she gave birth to my daughter in Kiunga.
And then the second birth was here in the village?
Yeah, here in the village, in the bush, yeah.
If you have another kid, would you want your kid to?
Yeah, to go through this program, yeah, yes.
Oh yes, we do find very hard life here. We find very difficult, especially in terms of sick and in terms of our ladies having a pregnancy. We find very hard to rescue them out, something like that. We find hard to take them out from our village. No, in our village now, we are very struggling at this time. So we sometimes loses the lady's life, you know, in terms of delivering.
For Papua New Guinean mothers, in future, I like to see healthy mothers giving birth to healthy babies, and their babies can be grown up, and they can be, educated in good schools, and they will be a next source of manpower in Papua New Guinea, and they can be leaders of the communities, and they will change the communities.
I was honoured to sit with many of the mothers who have walked this journey, and with local leaders and healthcare workers who carry this work forward each day. Their message was simple: continue and expand, because it works. Our aim at the Collective Empowerment Foundation is to empower the world's most remote and isolated communities, enabling sustainable growth, independence, and long-term prosperity. The Safe Birth program is one example of this approach. We also design, operate, and manage other programs, such as our renewable energy and clean water solutions that strengthen communities from the ground up.
We here in Wanufen, we do drink dirty water every day.
If you believe in a model that builds local capacity and lasting systems, stand with us. As a non-profit social enterprise, we need support from the community around us. Follow the journey, share the story. And if you're able to, consider partnering with or supporting our work. Together, we will continue strengthening support for mothers in the North Fly region, building a model that expands across the Western Province, scales throughout Papua New Guinea, and ultimately reaches communities around the world wherever safe motherhood is not yet guaranteed. Because the right to a safe birth belongs to every woman, everywhere.